The United Nations is observing World Suicide Prevention Day today in light of this global initiative and in response to the unfortunate increase in learner suicide. The Gauteng Education Department has unveiled a plan to deal with the problem. This comes after more than 14 cases of suicide attempts among learners in a period of a month at Tsakane Secondary School in Ekurhuleni. Newzroom Afrika's Zola Sholwana is in Marshalltown in Johannesburg and joins us now live. Zola, thank you for making time. What are we expecting there today?
Well, Clement, you might have heard that the briefing took place. You might also understand that there's been a scourge of suicide cases across the province, particularly the area of Tsakane in Ekurhuleni. You might have seen that we even went as far as visiting one of the families of, the children that committed suicide by allegedly ingesting rat poison. So today's briefing was basically the Department of Education and also other relevant stakeholders coming together to say, let us deal with the scourge to prevent more suicide cases. And obviously the most recent case is an 11-year-old primary school learner who committed suicide last week Friday apparently, this is about what we were told about the department, that the learner was accused of theft, of stealing an amount of about 300 rand by his parent. But to tell us more about the plans that were presented here today, we've got the MEC of Education, Sholwana. So thank you very much for your time. We understand that this is obviously a step towards a positive direction, coming up with a solution of dealing with the scourge of suicide cases, particularly in Gauteng schools. What are the plans that you have brought forward as a department?
Thank you. The first one is we had to ensure that we get the correct partners to work with us, especially specialists in the sector. That's why we've got SADC, we've got Teddy Bear Foundation, and quite a number of stakeholders have come forward to partner with us so that we can begin to deal with this issue. But at the center is prevention. We want prevention, we want awareness, we want to debunk this issue, because most of the time parents and schooling communities don't want to talk about it. So we are increasing the awareness of it, and obviously key as well is the early detection of signs that the learner or learners are probable victims of such. So that's what we do. So it's a comprehensive program that we've put in place. But first, and the program is awareness and the communication, therefore, that there is help. We have a number, 116, that they can call anytime, 24 hours, if they really need to talk to somebody. But also we've got counselors, the social development, all the sister departments are also on standby to ensure that they also provide support when required.
You also mentioned that in the next few weeks you'll be relaunching a program for parents as well to come on board.
Yes, that's where we want support. For the longest of time, parents have left the disciplining aspect of the children to the schools. And the school's job is to educate the children. But the discipline, the support at home is the parents. So that's why we are launching this parental program, where we are resuscitating it. We used to have it, we stopped. So we're going back, where we teach parents how to really assist the schooling aspect of the child.
Now, currently, how is the department supporting the learners of those, or rather learners that are close to the ones that have passed away in those schools that have been affected, particularly Tsakane Secondary School, and also families?
That's why I said we've brought in partners. We've got SADC, we've got our psychosocial unit that goes to the schools. Immediately there's an incident to debrief and support and also identify the impact of the incident on individual learners, where sometimes the learner can be affected to such an extent. So we're able to pick up those learners and bring in our partners on board to ensure that we support those learners. So we have the psychosocial unit, our partners. We're very quick in terms of supporting learners post an incident. We are always on time to ensure that we deal with it, but we don't want that. We want to prevent. We don't want to lose kids. We don't want to lose the future. And that's why we are embarking on this program. And that's why we're also sensitizing it out there, putting the communication out there that parents, community, schooling community, there is help. come forward. Learners, there is help. Come forward. We will help you.
Now, before I let you go, MEC, are these programs long-term? Will they continue even after your term?
No, they should be long-term. They will continue. I will be here, so definitely they will continue.
Thank you very much for your time. Ma'am, let me come to you. At this point, we obviously haven't identified the cause of, the suicide, and that's obviously because this is a complex issue.
It is correct. Especially as we're working more with the school, we're identifying some of the trends and issues that we're finding across Gauteng. So some of the key issues that we're seeing, and it's normally a combination of problems that will lead a learner to want to take their own life. We're seeing family problems, family abuse, family troubles at home, depression, bullying and trauma being some of the key factors that are standing out to us at the moment.
So how do you, as relevant departments, help in assisting these learners? Because this could also be a cry for help from the learners.
Absolutely. When we're looking at our young people that are in crisis and having to say we need to do more to help them. And this is why it takes so many partners to come forward and say we need to do more. Often what we're doing, especially as SADAG, is we get many requests from schools who've said we have an attempted suicide today, or we've lost a learner to suicide yesterday, please come in and help us. Now with the partnership with the department, we can actually do so much more to help those schools. And not just helping the learners, but also helping the teachers and parents. This takes an entire community to help our teens in crisis.
Thank you very much for your time, ma'am. Now, today is a World Suicide Prevention Day, according to the United Nations and the World Health Organization, and the Department of Education saw it befitting to actually respond to the scourge of suicide cases. And the MEC, Sholwana, also gave an update on learner placements, after his briefing, basically saying that parents should be receiving SMSs of confirmation for the intake of learners, and they should quickly respond to those failure to do that. They will find themselves in a situation where their children will not have schools, and also that could also help other children to be placed, because if they don't do that, then they'll be blocking space for other learners. Back to you in studio, Clement.
Zola, Sholwana, thank you for that update.